Greetings, welcome to the Diabetic Mogu podcast. On this podcast, we will offer standard and recommended practice of not only managing your diabetes home, but how you can get involved in advocating for proper access to healthcare and bringing opportunities within the diabetes online community. It's Tino, a patient advocate and a certified diabetes educator.
I'm Hona. I'm a recently graduated medical doctor. Together, we want to raise awareness, open a discussion about diabetes, share ideas, thoughts, different perspectives, and overall create a safe environment for everyone who needs to express his or her thoughts.
We'll be hosting a series of podcast episodes from people living with diabetes, caregivers, healthcare providers, researchers, and we encourage you to get involved, get engaged, and come up together to create the change that we need. Greetings to you, Dr. Mohammed. I think the first thing people might just need to hear, like, who you are. Yes.
Of course. Thank you so much, Tino. Again, thank you so much for the invitation. Thank you for having me today. My name is Mohammed Seyam. I am a medical doctor. I am from Gaza, Palestine. I am a young leader in diabetes. I'm a DDoc voice. I am the MENA region representative at T1 International. So generally, we can say that I am a diabetes advocate, and I always fight for the rights of people living with diabetes, including myself, being living with type 1 diabetes for the past 12 years now.
Everything about you is connected to diabetes, and now you're a medical doctor yourself. That is great. First off, people may just need to know, like, how you were diagnosed with diabetes. I believe everybody has got a unique story to tell.
Well, my story is not really that unique. When I was in 7th grade or something, I asked my teacher to go to the restroom twice in 40 minutes class. And he was a bit confused. Why would you want to go to the bathroom twice in one class, in one lecture? So he said, you should get yourself checked, because I was one of the top of my class. So I wouldn't just ask to be out of the class for nothing. I got checked and I had diabetes. At first, nobody actually in my family knew what diabetes is or how to deal with diabetes. Although my grandfather had type 2 diabetes and he kind of knew what taking insulin is like, because he was on insulin. The good thing is I got a lot of support from my family, and that what made the continuous momentum of me being positive, living with diabetes happening up till now.
About that, since you say, like, you were diagnosed when you were in school, now can we say that, like, the path that you had to take in your career, it was somehow motivated with diabetes? That's why you wanted to do what you're doing?
I've always got this question asked to me, but I've always wanted to be a doctor since I was a little kid. And I didn't actually want to be a doctor that is related to diabetes in his work. I wanted to be an orthopedist, doctor who does everything with bones. I wanted to be a bone surgeon. Everything changed about 3 or 4 years ago when I started my advocacy journey, when the whole Zoom era started and we started meeting with a lot of people from all around the world, and I started educating people about diabetes. And I thought, this is what I want to do in my life. This is the career I want. I want to help people whom are just like me, whom I can understand, whom have the same experience that I'm having. So I could help them more than any doctor would do. Because if you're a healthcare professional, you wouldn't actually understand everything or every detail about living with diabetes. But if you're a healthcare professional and the person living with diabetes having this experience, it would make a difference to your life and to the people's life around you.
We've been using the hashtag to say, hey, nothing about us without us. Here's the patients. We need to get a seat at the table. Now it's a patient and a doctor in the same person. I think the narrative would be different. They should be listening to you more because you're living with this, besides you being a healthcare provider yourself. With everything that has happened, you getting diagnosed, and you're also part of the Palestine community, things are happening there. So I don't know if you'd care to share with us, like, what has changed, like, over the years within your community in terms of access to care.
Oh, of course. Just like any other community, maybe in the region, or you might know yourself in Africa, the Palestinian community is a very conservative community with lots of stigma, lots of discrimination towards anybody living with diabetes. And this is how things started. When I came out saying that I'm a type 1 diabetic and I want to be an advocate for diabetes, people really started wondering, what is he saying? And what are all these things happening? But slowly people started to understand because now our voices are being heard and now we are loud. So if I came out to talk to people about diabetes, other people living with type 1 diabetes or type 2 diabetes would really want to talk more and more. They want to share their experience now that somebody is doing it and it's working. So it started like this when it comes to the community. People now are realizing more that there's nothing wrong with living with diabetes. We can do whatever we want. Life is just as normal as anybody else. In fact, we might be, if we take very good care of ourselves, we could be maybe better or healthier than people who consider themselves healthy people. So yeah, things are turning a bit slowly, but very well when it comes to the community. Things are getting easier. We need a lot of support. We need a lot of education because we lack that. But the good thing is for us as a main change when it comes to the healthcare system, we used to have insulin vials available in the government. And now, a year and a half ago, we were able to get insulin analogs, the insulin pens, available for free for every Palestinian living with diabetes. This was the milestone that we were able to achieve because the WHO updated their essential drug list in June 2021 to include insulin analogs. And it was the pressure point that we could talk to the government to get insulin analogs as part of their essential drug list in the country. Yeah, right now things are going well. The only problem is that we're a low middle income country, so a lot of the drugs that we get from the government really rely on donations, and that's a problem. Sometimes if there are no donations, you would get lacking when it comes to providing the people living with diabetes with their insulin. But at least now it's acknowledged that insulin analogs are part of the essential drug list. Access to insulin is getting better. Education in the healthcare system is getting better by time. So a lot of movements are happening. Hopefully soon, by time, we'll be able to do much more.
Out of words. This is amazing.
It's always because of how amazing the whole diabetes community around the world is. The support, like we would never be able to do the things that we've done in Palestine if it wasn't the amazing support from the diabetes community earlier back then. Because everything with the whole insulin situation started with a video call from an international diabetes community, from the League of Diabetes, and that call, having a lot of people from different international organizations and NGOs, we were able to actually improve something and do something. Diabetes in Palestine, the support has been massive. The support has been magnificent. It's always what we give to others is what helps us be able to achieve more.
Great. Now that you brought it up to say the international community reached out, maybe it could be an inspiration. It would serve as an inspiration to so many people that will be listening to this today or maybe years later. The diabetes community is coming up together and we are saying that there's nothing about us without us. We are stronger together. Hey, we need to pay it forward. If you've been helped, you need to help someone. I don't know if anybody had already told you to say if we do join hands, maybe you knew about this, to say if we come up together, it's going to be helpful. What made you to get involved in this diabetes community, to get involved so that you can advocate as a whole?
For me, it wouldn't have started if it wasn't this way. My whole advocacy journey started, okay, I was talking to myself, to my friends around me, to my family. I was advocating in a narrow circle. But once I joined the Young Leaders in Diabetes program by the International Diabetes Federation, I got to know more and more people living with diabetes from different parts of the world. And now we had the opportunity to talk to each other, to support each other, and share experiences. Thus being done, or thus happening, we were able to extend our circles. We were able to get to know more people, more international organizations, more NGOs, more communities. The thing that would attract everyone living with diabetes to such communities is that everyone there is there to support you. Everyone is going to help you. Everyone understands your problems. They've been on the same thing before. So why not would they help you? The most precious thing about being part of the international diabetes community is that you will get supported. People will always love you for what you do. People will always give you resources. They will always give you advice on how to change things based on their experiences, based on what they've done in their societies themselves. So it's always the support. And it's always what drags me more and more to know more people, to get involved with more people and more communities, more organizations, because this is how we grow as individuals. This is how we think better as advocates to actually improve the way we talk to decision makers or we talk to the community to create the change that we want to create.
I think it always helps when there are call for alerts by the international organizations such as the IDF, World Health Organizations, and then you take that up to the next stage to say, hey, you government, I think we need to be discussing about these things, taking it as a pressure point to say, already this has been the talk of the moment. So I think we need to do ABCD. That's great. And it's usually different in our communities on how, if a person is to suggest these things, let's say he's talking about it on social media platforms, maybe the government might feel that this person wants to get credit for the things that they are suggesting to us. It's usually different. Since you got engaged in the advocacy for access to diabetes care, there seems to have been a positive change with what you said. Now, analog insulin has been added to the list, and now people can access these things. So if you could kindly take us through how that was even possible for advocates to convince the government to do this.
Whenever you're facing a problem, or wherever you want to work with the government, let me say, or with any organization locally to change the lives of people living with diabetes in your community, you need to have your goals objectively planned. Everybody now knows about the SMART technique when it comes to how you need to implement your goals or do everything you want to do. But other than that, it's again the support that you might need from other people in your community or other people from international communities. So it's the support, it's being very well prepared. And what happened for us in Palestine is that a lot of actions were happening, a lot of things were happening at the same time that helped us to get through with what we wanted to get through with, which is access to insulin analogs, to make that possible, to make that happen. So yeah, let me say you need to be very, very well prepared. The Ministry of Health, for example, is not your enemy, let's say, when it comes to the government, because the Minister of Health, for example, or someone who's responsible for diabetes or the non-communicable diseases wouldn't turn down an offer to help the community or to support the people in that community. But the problem when it comes to governments always comes to how to financially approve such thing. Because if you want to do anything in the government, this would cost the government money. And would the government be able to give money for such projects? This is the real question when it comes to the government. So if you're very well planned, you need to tell them, why are we doing this and how beneficial this thing would be to the government? If I'm giving people access to insulin right now, this would help them not suffer from complications in 10 years, and complications of diabetes would cost the government much more than just some analogs. So it's just the approach of how you need to talk to the people who are deciding this, how the policymakers are going to be convinced with what you're saying. So get yourself very, very well planned, get different scenarios in your head. Think, what would this person say? What would be the problem with that person? What would be the problem with the person in this position? And think of a solution in your mind with not alone. You always need support, not alone. Think of a solution with your colleagues and whom you're working together as a group in that community, or international friends who've been through. So doing all of that would always get you steps closer to the goal of access to insulin in your country or in your region or in your city, for example. It's not always easy to work with government. We all know that because they don't like spending money. An important advice is that advocacy takes time. You wouldn't be able to just do things and, in a month, I'll be able to get things done in my country. No, that would never happen. It took me years of trying to get things done in my country to be able to provide or to help with access to insulin. And I've been trying to do different things in my country. But again, it's one step at a time. It takes a lot of time to actually do things, but eventually, as long as you're saying, as long as you're advocating, as long as you're telling the story of yourself, of the people around you, you'll be able to convince everybody with facts that this is the right thing to do. And we need this because access to insulin is access to health, and access to health is a human right. And we need that as people living with diabetes.
We are inspired by your words, everything, the detail, how you had to walk us through it. Before we do anything, you need to do a research. How is it going to help the people that I'm going to ask? If I need a sponsorship to go to college, say I need sponsorship to go, maybe I want to do a master's. So how is it going to help the organization that is going to fund you? They need to know. How is it going to serve them? Because just having access to insulin for someone, it could maybe help serve the government, because if that person gets ill, gets hospitalized, they will need so many things. right? And even the government might need to provide so much in terms of healthcare providers themselves to make sure that things are going well. Thank you. It's an inspiration to say that like the people that are already involved right now, they'll know there to say, hey, if the Palestine community could achieve this, then you continue to do what we're doing, even we try to refine objectives to tackle it this way. Maybe people are going to come to you asking you questions.
Even if things didn't work the first time, you could always take a step back, rethink what you've done wrong. You haven't done something wrong, but maybe the approach was not the right one. So maybe you could just need to change that approach, or maybe you just need to change the persons you're talking to, or the people you're talking to. Maybe it was not right from the very beginning to talk to, let's say, for example, the diabetes in the Ministry of Health. Maybe I should have gone directly to the Deputy Minister of Health in my city, for example. So it depends on, again, it's not an easy way, but it depends on you actually believing in the cause that you're advocating for, always going for it. So there's something I just remembered. In this new world model of how things are going, it's all about marketing. If you're marketing your ideas, if you're marketing your plans in a correct way for the people you're going to, for the policy makers, it would alter how they think, just because how you presented yourself, how you presented your idea. So it's always about marketing. How am I going to convince those people? So keep asking yourself questions throughout the whole way, and keep trying to find solutions and answers to those questions. And then you'll be able to knock it off. You'll be so prepared that nobody could stop you. This is the beauty of advocacy.
That's it. I'm also interested in knowing about the access to CGMs, pumps in Palestine. Is it an issue there?
There is an issue. Yeah, we were able to get access to insulin, but unfortunately access to, let's say, glucometers and test strips and CGMs is not yet there for the government itself. If you need anything, you need to buy that out of your own pocket. Test strips, they don't really cost a lot of money, but access to CGMs and pumps is not there at all. So if you need to get yourself a CGM, you need to buy it from a different country and then get it shipping to Palestine or to Gaza, to be more specific, here in my city. And that would take us month to do that, because shipping into the Gaza Strip is not easy, because the whole Palestinian territory is occupied, is under occupation, and it's not easy to get things, especially things that are related to technology, into the country. Access to CGMs and pumps is not there yet. We're still fighting for the basics, fighting for insulin, education, and glucose test strips. Hopefully soon we'll be able to be done with the basics and then start advocating on a different level and accessing to CGMs. Some people say it's just a luxury to have a CGM, but I hardly believe not, because if it would make my life of living with diabetes easier, it's not luxury. Just me supporting myself to live a healthier life, or to lead a healthy life, to be able to provide more, to be able to, again, cost the government less money in the future with less complications, because we've seen how, with research, how important these technologies or these diabetes supplies are to us living with diabetes.
Priceless tips. They're going to be helpful. From you as a person living with diabetes, and now you have just maneuvered yourself, healthcare professional yourself. What has been your biggest learning with diabetes?
I could just go so deep now. I could be just a deep person. I've always said it, diabetes have made me a better person. That's the easiest thing I could say. I would never be in the position I'm in right now without diabetes. If it wasn't for diabetes, I wouldn't be able to meet amazing people. I wouldn't be able to have traveled different parts of the world last year, for example. I wouldn't have been able to talk to the government, to change people's life the way I'm doing right now. So my biggest learning from diabetes is that I can do anything, full stop. Diabetes has taught me to be more powerful, has taught me courage, has taught me cautious when it comes to how to talk to people, has made me learn that I myself alone, I can't do things impactful as it would be if it wasn't for the whole community. And that is why I think we're always wearing the same bracelet now, Unite for Diabetes. That's the whole story. Diabetes has taught me that there are a lot of people around the world who share the same experience as I'm sharing, who share the same ideas that I'm sharing. And together we can create a change in this world. Together we have a loud voice that we can advocate for the condition living with. So yeah, the biggest learning is that you need to think of positive diabetes in a positive way to be able to actually do something, to be able to get diabetes out of your this is my tackling problem, diabetes is tackling me, and change the whole concept into diabetes is my superpower, and diabetes is something that fuels me more and more to create a change in my community, in the whole world. Again, advocacy has been a roller coaster, so same as living with diabetes. Advocating for diabetes is never easy. It's never 1 + 1 = 2. No, it's totally different. Things hard at the beginning or at the end. In the middle of the way, you might face rejection. For example, local NGOs that you want to work with would refuse your ideas. The government would maybe refuse your ideas at the beginning, but slowly, by keeping consistent with what you believe in, by being consistent with your ideas, by planning very well for the future, you'd be able to do more. Just have the courage. Just ask for support whenever you need, because everybody in the community would love to always support you. So ask for their support, ask for their help, ask for whatever you need, so you could eventually be able to achieve the things that you want to do.
Well said. Thank you so much for explaining it, and in a way that everybody would be convinced to say, hey, these are practical tips, and I'm learning it from someone who's living with diabetes, someone who's walked the walk, someone who's part of a number of different organizations altogether. So like, what word of advice would you give to people living with diabetes with regards to coming up together to help create the change that this world needs, providing now that you're part of the T1 International, IDF, DDoG, ESPAD, just to name a few? Maybe there are a whole lot that have joined recently. So take it away.
I kind of answered this partially in the previous question, but again, you need to believe in yourself. You need to, the main advice I would tell anybody is that you're never alone. Sometimes you might feel burned out because of diabetes. You might feel like the whole world is not working anymore. I can't get access to the things that I need or to the things that my community needs. But you always need to remember, you always need to remember that you have a voice, and you can use your voice all the time to talk on behalf of your community, to talk on behalf of everybody living with diabetes, that we can create a change, and we are on the way to create the change that we want to see in this world. Because again, we're united for diabetes, then we'll be able to achieve much more. So remember, this is the most important thing that I had myself. Having a positive mindset of how to live with diabetes, or of living with diabetes, plus getting the support that you might need from your community, would mean the world, and it would get you going to everywhere you want to go when it comes to advocacy.
Thank you so much. Now, this is the last, or maybe the bonus question that I would ask, and I would need you to say it in your own language. Arabic. Ooh. Yes. Let's say a person who has just been recently diagnosed. There's a lot of denial. I've approached you. Like, I've seen you with this. Yeah. Or they like to say, yes, but first incident. And then I'm just taken away with it. What would you tell me? People thought diabetes is a disease that people get when they are old. But now seeing you that you're a young person and you have diabetes like myself, what word of advice would you give me? In Arabic, of course.
I can answer in English and in Arabic if that would make things any better. In Arabic, I would just tell people أنت دايما مش لوحدك، وإحنا موجودين سوا لحتى نعلم بعض، لحتى نخدم بعض، ولحتى ندعم بعض، لحتى نوصل لأفضل طريق إحنا بنقدر نوصله بالتحكم بمستويات السكر في الدم. لازم كلنا نعيش الحياة المثالية، لأنه ما في حياة مثالية موجودة، ولكن إحنا بنحاول دائما لحتى نوصل للأهداف اللي إحنا بنحاول نوصلها بالأساس. إحنا دائما موجودين جنبك أو جنبك لحتى نوصل لهي الأهداف، لحتى نتعلم، لحتى نتثقف، لحتى ندعم بعضنا نصل لهي الأهداف. In English, that would just simply be, we're always there for you, we're always supporting you all the way, educating each other, supporting each other, learning from each other's experiences, because you need to know that you're not alone in this world, you're not alone in this journey, and everybody around you in this community would always be honored to love and support you and to give you whatever you want to keep going.
Perfect. I believe the community is in safe hands. If people are going to see you in Palestine or wherever they're going to see you, they can get the hopes, because you're coming bearing gifts, your daughter, yourself, And I think, of course, you'd give them free tips. So thank you so much for that. And also learning from your lived experience. That is great. If there's anything that we haven't discussed that you might just want to say?
We've said it all. Yeah, we would always be happy, same as anybody else in the community. I'm part of it. So I would always be happy to talk to people, to support their ideas, to share my experience or to get their experience shared with me, because I'm not that perfect, and I'm not a perfect guy. I'm always up to learning, because I also have my flaws. I always have my mistakes when it comes to advocating. So I'm always up to learning. I'm always up for discussions. I would love to always meet anybody who could help me or whom I can help based on our own experiences. Again, diabetes is not easy to live with, and we always need support. We always need those who we could talk to get to the points that we aim to get in the future. So yeah, again, thank you so much, Shino, for having me today on the podcast.
No, thanks to you.
It's a pleasure. It's been an honor. Looking forward to how things would go in the future for both of us, because you're doing an amazing job as well in your country and the community and the whole community internationally. So can't wait to see how things would turn in the future for the whole community. And yeah, let's keep a good fight for access to insulin, for access to diabetes supplies, and hopefully for a better life for everybody living with diabetes across the globe.
Well, I cannot thank you enough. I don't know what to say, but I'm grateful that you had to take your time to do this with me, to help serve the community, so that people, they are always expecting, we need a different perspective, and so that they can learn from so many people. They're coming together. We need to come up together to do this together, because learning from others and what they're saying. So